I am going to give you a masterclass in breast implants in the next minute and a half. This is one of the most confusing things for women to understand when they're having reconstruction. I will start by saying I use Allergan brand implants, so a lot of that is going to be based on their terminology. There's similar terminology for different implant brands. Patients will come in saying, I want a high profile implant. You can't choose that in breast reconstruction. Here's what you can choose. When you choose an implant, it's based on your base width, which is the width of your breast. I have to adhere to that. If I used an implant that was too wide, it would look weird. You'd have side boob. If I used an implant that was too narrow, it would look like you have a softball in your chest. So that is an anatomical non-negotiable breast width. The second is the volume. So if you're having direct to implant, it is what it is. I'm going to put whatever implant fits at the time of the mastectomy. If you have a tissue expander, you can expand it to the size goal that you have, something to keep in mind. But when we're doing either the direct to implant or the tissue expander to implant exchange, the volume is the volume. So I don't have any choice about that. So I have no choice about the width. I have no choice about the volume. Thus, I have no choice about the projection. That makes sense? The projection is just an arbitrary term that Allergan uses to separate a 15 centimeter base width implant that's 700 cc's, that might be a high profile, to one that's 300 cc's, which might be a low profile. It's confusing terminology, but when I talk to patients, I talk to them about volume. So when you put your hands on your breast, are you happy with the volume? That's the most important thing. The other thing I will say, when you think about projection, an implant is a half circle. A breast is a teardrop. So the volume distribution is always going to be different with an implant than with your native breast. That's also a point of confusion for patients. I hope this made sense. If you have other questions, let me know in the comments.